Hello everyone, my name is Janet Ratliff and my video is on depression. I chose the Psychiatric Nurse Practitioner program at Upstate Medical University because mental illness, perhaps more than other diseases, not only affects the patient but also affects the patient's family, friends, coworkers, and the community at large. After more than 20 years of caring for people with mental illness, including many with chronic conditions, I have seen and understand the difficulties patients face in their lives. In this video, I will discuss depression, identify helpful internet resources that are available for depressed individuals and their families. What is depression? Depression is more than sadness, loneliness, or feeling down. It is a chronic illness that affects how a person thinks, feels, and functions. Depression can cause feelings of suicide or impair an individual's daily functioning. Individuals that suffer from depression can experience anxiety, sadness, insomnia, helplessness, hopelessness, and guilt. Depression can impair concentration or cause feelings of worthlessness. Depression is a tragic chronic illness. How do you diagnose depression? 5 or more of the following symptoms must be present and last 2 weeks or longer to meet the diagnosis of depression. These symptoms must be present nearly every day and all day long. These symptoms must represent a change from prior functioning, and the symptoms are depressed mood, decreased ability to concentrate and think or indecisiveness, diminished pleasure or interest in most activities, feelings of guilt or worthlessness, loss of energy or fatigue, increased appetite or significant weight loss, reduction of physical activity or thought, insomnia or hypersomnia, recurring suicidal ideation or thoughts of dying. What are the risk factors for depression? Genetics, poverty, stressful or traumatic events, certain personality features as decreased self-esteem or pessimism, drug or alcohol abuse, or environment. Depression can strike anyone at any time. What treatments are available for depression? There are numerous ways to treat depression: medication, psychotherapy, lifestyle changes, brain stimulation therapies, and electroconvulsive therapy, or ECT, for refractory depression. There are numerous types of psychotropic medication for depression, and there are different types of psychotherapy for depression also. Maintaining a healthy lifestyle can help combat depression. Exercising, maintaining a healthy diet, and getting enough sleep can also help with depression. Transcranial magnetic stimulation is also effective for depression. Electroconvulsive therapy, or ECT, is usually a last resort for depression and usually for refractory depression. What are the best websites for depression? There are numerous resources available on the internet that can help inform individuals about depression and how to cope with the disease. The following websites provide education and support for individuals and their families that are afflicted with depression. The National Alliance on Mental Health, or NAMI, is an excellent website. Substance Abuse and Mental Health Services Administration, the National Institute of Mental Health, the American Foundation for Suicide Prevention, Families for Depression Awareness, and there are many more. Some websites for depression are the National Alliance on Mental Health, or NAMI, is the nation's largest mental health organization, which is devoted to helping people that are afflicted with mental illness. They have many resources available, including information about depression, treatment options, and groups for individuals, parents, and families of individuals with mental illness. The Substance Abuse and Mental Health Service Administration helps reduce the impact for individuals that suffer from mental illness and substance abuse. Congress established the Substance Abuse and Mental Health Services Administration, and it provides services, information, support, and research to help individuals that have mental illness and substance abuse disorders. It provides information to help people recover. The National Institute of Mental Health is a federal agency that provides resources and research on mental illness. Depression is included in this website. It is part of the U.S. Department of Health and Human Services. The American Foundation for Suicide Prevention raises awareness of suicide, provides resources, education, and funds and research to assist individuals affected by suicide. Families for Depression Awareness is another site. It's a national organization that helps families cope with depression and provides education, advocacy, support, and outreach for families and caregivers. Depression is a serious chronic illness that affects how individuals think, feel, and function. Depression affects the daily life of individuals, their families, and everyone around them. Individuals of all ages are affected by depression, and they can occur at any time. Nurse practitioners can teach and help patients cope with depression in order to lead better lives.